Hello, everyone, and welcome. Thank you so much for coming to join this weekly session of the COVID-19 Survey Working Group. This is a group that brings together survey researchers who have an interest in COVID-19 research from around the world. And on this call, we really do have several continents represented, and it's great to see everyone. Whether you're joining on Zoom, via YouTube Live, or watching the video later, we're glad to have you. My name is Dr. Eric Kendi, and I help to facilitate and coordinate these group discussions, though mostly we hear from guest experts. And I'm so excited this week that we're going to be able to hear from a team from the Berlin Social Science Center about work that they've done on retrospective survey questions. It will give us a chance to get into the nitty-gritty of question design and how this works in the COVID-19 context, and elements that I think will be of interest to different researchers working on trying to assess people's behaviors and attitudes. Before we get started, I do want to share one note from a working group member who is unable to be with us in real time today. Massimiliano Bucci from the University of Trento in Italy just wanted to announce that they have a set of new data from the Italian National Survey that follows up longitudinally on a number of previously surveyed trends and includes some new questions about vaccine attitudes. And so I've shared that link in the chat within the Zoom call, and you also should have access to that from the mailing list of the working group. So always a chance to share updates like that, and hopefully you're able to check this out and see what they're doing in the Italian study. With that, I do want to move on quickly here to our guest speakers this week, who I'm so appreciative to have joining at this hour from Berlin and Europe. We have with us Dr. Hipp and her team from the Berlin Social Science Center. I'll leave it to you, Dr. Hipp, to introduce the folks who will be sharing today. We'll begin, as always, with a presentation about the work that you've been doing, which was part of a really interesting special issue on survey methods. And then we'll move towards an open conversation. And so whether you're watching live on Zoom or live on YouTube, please use the chat to share your questions, and I'll try to pull them together into a facilitated conversation as we go forward. With that, Dr. Hipp, the floor is yours.
Oh, thank you so much. I'm very happy to be here tonight and to talk about the research that we did on retrospective questions in COVID-19 surveys. And the presentation that I'm presenting tonight is largely based on an article that we've published in the COVID-19 special issue from the Survey Research Method journal. And I'd like to stress the fact that it's collaborative work. Armin Sauermann and Stefan Munnes are here tonight, and Mareike Bünning, the fourth author of the paper, is unfortunately sick at the moment, so she can't be here. And, you know, writing the paper together with my colleagues was a real pleasure, and they're here to also answer questions later on. So here's the link to the article. So the issue of answering how people answer to retrospective questions is of major importance in COVID-19 studies, but also in other studies across many disciplines. So survey researchers in sociology, in epidemiology, or medical studies are interested, for example, how many people, respondents met during the last week, what their mobility patterns were, etc. The problem, however, is that respondents often do not remember exactly what they were doing, if they remember at all, in the past. And, most of us surveys researchers are not as lucky as these policemen that you see on this cartoon, who asked their suspect about the diet, and this person answers, well, if I recall correctly, now I have to move here. If I recall correctly, on April 17, 1991 at 6:37 p.m. Eastern Time, I ate 6 ounces of grilled salmon steak, and so on and so on. We may remember what we have eaten today, but we have probably a hard time to remember what we eaten for lunch or dinner a week ago. And this is the big problem that we face when asking retrospective question. So why do we have such a hard time to remember? And there's a couple of reasons in the existing literature. So first of all, when we are asked about the past, for example, with how many people we have had contact, I first have to remember, so what, when I was asked, with how many people did you have contact before you fell sick? I first have to remember when exactly did I feel sick. Then what did I do that particular day? And then only on the third level, I can try to remember with whom I had contact. So it's really complex, and retrospective questions often entail many different aspects. Moreover, it's difficult to remember details, in particular if they're not important to us, if a lot of time has passed, or if the question relates to subjective assessment. So how did I feel a particular day before I fell sick? How satisfied was I with my work before the lockdown came, etc. And last but not least, humans tend to adjust their current attitudes and feelings to what, vice versa. Humans tend to adjust their past to their present. So they, make the past look more similar than what it might actually have been, just to have, to fulfill this need for consistency. And this is what, in particular, psychological research has shown us. So the question that hence arises is, how bad is it to ask retrospective question? For example, when you're doing surveys to learn more about the spread of the coronavirus or how the pandemic has affected, individuals' lives. So to answer these questions, Mareike Bünning, Stefan Munnes, and I, as we were interested in these questions, we launched a survey right after the lockdowns had taken place in Germany back in March this year. And with our survey, we wanted to learn how people's daily life has changed as a consequence of the lockdown. And we were particularly interested in how these experiences varied by socio-demographic group. And we used these data to also assess how accurate retrospective questions are. But I just want to give you a quick overview on the data first. So the data were collected online with volunteers, and due to the voluntary participation in the survey, our data is biased. So highly educated individuals were more likely to participate in the survey, women were more likely, and we also have more individuals participating from Berlin, which you can see on the right-hand side map of this slide. In the survey was run for 3 waves, so we collected data at 3 waves, and in the first wave we had also introduced some retrospective questions. People had to tell us, for example, how they divided housework chores with their partner, for example. And due to a little incident, we could actually use our data to assess retrospective question. And this came across the following ways. So shortly after we had launched the survey, a colleague approached us and asked us whether it would be possible to introduce a couple of survey questions that are of great interest for her research. And as we are really nice colleagues, and as all people at the WZB are, we were of course open to that. So we introduced this question, but the survey had already run for more than 2 weeks until we had the questions ready, etc. And as we wanted to give her the chance to, have as big sample as possible, we also asked these questions both for the current situation and in retrospect for the time before the pandemic to those respondents who had already participated the first time. This means that we have part of the survey participants answering the retrospective questions twice. So the first time they answered the questions 3 to 5 weeks after the survey was launched, and they answered the retrospective questions the second time after 6 to 8 weeks. And I need to mention that all the data and also the replication files for our SRM article are publicly available, and of course you can you can replicate our analysis and maybe enlarge them with a bigger sample, and also use the data for other purposes, of course. So the 5 retrospective questions that our colleague was interested in were interesting for the assessment of retrospective questions because they concerned different aspects. So one thing that she was interested in was in working schedules, so whether and how often respondents worked evenings and nights, how their physical health how they assessed their physical health at the current situation and also before the pandemic, as well as their mental health. And so at the time that we did the analysis for the SRM article, around 1,500 respondents had already answered the retrospective question twice, and this is the sample that we draw on in our analysis. So, the first question that we asked, that we wanted to see is, how did the means in the retrospective assessment between the 2 time points differ? For these 5 items that differed in their nature, how objective or how subjective they were, and also how complex they were. Because for the mental health items, and I'm happy to show you the items later, there were several elements in what people had to say, how they felt. And in the first step, we just compared average, and we did paired t-tests. And in the second step, we assessed inter-rater. So we assessed the reliability with which respondents answer to these questions with Cohen's kappa. And for those of you who are not familiar with this measure, you can essentially think of it as an ICC for categorical variables. So values of 0 mean there's no agreement between what I said at time point 2 compared to time point 1, and 1 would mean there is perfect agreement. So let's look at the mean rating first. So what you see here is our 5 measures. So evening work, night work, mental health 1, mental health 2, and physical health. And all items were measured on 5-point scales. The black dots are the mean ratings and the confidence intervals for the first retrospective assessment, and the white dots are the mean assessments for the second retrospective questions. And essentially what you see is that there's no big difference on the average level. So the only exception is the second mental health question. So here there is a significant difference between the 2 assessments. So the longer the time before the pre-pandemic time has passed, the more negatively rated respondents their pre-pandemic mental health than they did at time 1. But still, this difference is really small, so it's almost negligible. So the point that you probably should remember here, it's okay to use retrospective questions if you are just interested in compare mean ratings, as long as you ask them in a reasonable way, and I'll come back to this issue later. So now we turn to the rating consistency on the individual level. Here again, we see substantial agreement for questions on working schedules. So here the Cohen kappa is above 0.6 for both nights and evening work, but we only see fair to moderate agreement for the 3 health measures. So 0.35 for both mental health items and 0.41 for the physical health item. So here the point to remember is that you have higher consistency also on the individual level when you ask respondents to recall objective information compared to more subjective information. I need to note, however, that in contrast to previous research, we only found small difference between the simpler physical health measure and the more complex or complicated mental health measures. So the next question we asked was, did recall accuracy deteriorate with the time between the start of the lockdown and the time at which respondents filled out the survey? So, and to do that, we ran multinomial regression on the consistency of the answering behavior. So the dependent variable was the deviation between what I said at time point 2 compared to time point 1. So whether I said the same or whether I gave a more negative assessment at time point 2 than I gave at time point 1, or a more positive assessment. So it's a categorical variable with 3 outcomes. And we did, we had this trichromatization of our outcome variable for all the 5 measures. So, and as time obviously has several aspects, so there's certainly the more objective aspect of time. So, we can count the time in days, but there's also this more subjective element of time. We essentially tried out 2 different things. So first we asked, so did the consistency change with the length of time that had passed between the 2 surveys? So between the survey 1 and the second survey, and did the respondents' consistency change with changes that have occurred for them between the 2 surveys? So did the assessment somehow change when their situation got more negative or more positive? For example, if they worked more often at night, did then their assessment how often they worked at night before the pandemic change? Or if their health deteriorated, did they then also say my health was already poorer before? So this is what we really want to find out. And as I said before, we have a non-probability sample, and therefore it was also particularly important to adjust our estimates for all possible alternative explanations. So this is important in general, but with such a sample in particular. So what did we find? So the first thing is that we didn't find any difference in recall consistency depending on the number of days that has passed between the surveys. So some participants filled out the second survey earlier than others, and we used that time to see whether there was a difference. And here we didn't find any difference. It's important to note, though, that you can't extrapolate from the short time period that we used in our survey to any time. So I think time is important, but it's not that important if it's not too long. However, we found quite some inconsistencies depending on how the respondent's situation has changed. And what you see here is the adjusted predictions for the consistency of respondents' answers to the 5 retrospective questions, depending on how their situation had changed between the first time they had filled out the survey and answered the retrospective questions and the second time they filled out the survey and answered the retrospective questions. So let me walk you through this graph, which might not be intuitive at first sight. So in column 1, you see the predicted probabilities for assessing the pre-pandemic situation when the situation had become more negative between survey 1 and survey 2. The middle column are the predictions for those who did report similar work schedules or similar mental and physical health states at time 1 and time 2. And in the third column, it's the predictions for those who were more positive about their current situation at time 2 than they were at time 1. And here you see the direction, but it's probably easiest if we first focus on the middle column. So what you see here is that those respondents for whom the situation between the 2 survey waves had not changed, the probability of giving an accurate answer is around 80%. So for those where something has changed, the probability is a little less, is a little lower. It's around 60%, for example. And then if you look at the left and at the right column, you can see the direction in which their retrospective, in which respondents' assessment of the retrospective assessment has changed. So if I experienced, for example, more work at night between survey time 1 and survey time 2, the likelihood that I reported a worse situation for the pre-pandemic situation was higher than if there was no change. And likewise, if I had worked fewer evenings, for example, or fewer nights, I was more likely to assess the past more positive as well. And this pattern holds through all the items that you can see here and that we investigated in our study. We also investigated, or in our regressions, we also investigated whether consistency decreased depending on the socio-demographic background of the respondents. And here we only found for one item, again, the complex mental health, item 2, that respondents with a tertiary degree were more likely to provide consistent estimate of feeling depressed, hopeless, strained prior to the pandemic than other respondents with lower education. We did not observe any difference by age and gender, and this is pretty much in line with what previous research has found, that either reported that sociodemographic characteristics were unrelated to recall accuracy, or found higher recall accuracy for highly educated respondents, and some studies reported lower recall accuracy for older compared to younger respondents. So I need to say that the older respondents were also less frequent, or participated less frequent in our survey than it would be the case if we had worked with a probability sample from Germany. Okay, before I conclude, let me talk about limitations of our study. So as the data stem from a non-probability sample and are biased with regard to education and supposedly also motivation to participate in the survey, it might be the case that we underestimate recall biases. So if you have individuals who do not volunteer to participate, maybe they are also not as eager to answer survey questions correctly. The counter argument would be that, you know, maybe in these voluntary surveys that are not incentivized, maybe participants don't pay so much attention. So there might be a bias, but we are not really sure in which direction it might go. The other limitation is that we actually only look at the consistency in answering patterns for retrospective questions and do not know what the mental health situation, the physical health situation, or the working schedule situation really was before the pandemic. So as we only collected the data after the lockdowns were enacted, we do not know what the situation previously was, but we can only see whether respondents are consistent in their answering behaviors. So let me conclude. So answers to retrospective questions tend to be unreliable at the individual level. So this is the sad truth, which our study also confirmed, in particular because respondents' assessment of the past is correlated with their current situation. However, you know, for some types of questions, it might be okay, and retrospective questions are also okay if you are only interested on the macro level. One need to note, however, that even on the aggregate level, one has to be cautious because, you know, if there is a change going on, and presumably the COVID-19 pandemic, you know, is changing a lot of norms, what people do, washing their hands, etc. We might even observe shifts on the aggregate level when using retrospective questions to assess change. So this is something that we could not really test, but we can imagine that this is the case. So what do you do? So the best thing that you could do with retrospective question, have some population estimates, either, you know, for a proportion of your sample or the general population of interest, or a comparison group for whom you have data for T-1 that are reliable, but and there are statistical methods that you can use if you have this data to calibrate your retrospective questions, but in most instances you don't have, and therefore the recommendation that we can make is, you know, if you use retrospective questions when you can't avoid them, you know, keep them short, keep them easy to understand. So all the, you know, 101 on survey questions you should adhere to. Ask only one thing per questions, you know, focus on objective questions, not subjective assessments. Use introductory texts in order to give respondents time to think about their questions. So remember this question of, with how many people did you have contact before you fell ill, and all the complexity that is actually involved in a question that sounds pretty simple. And what is also helpful, particularly if your questions are more complicated, ask summary questions first and get deeper into specific questions only later on, to help respondents to cope with the cognitive load associated with these questions. And last but not least, anchor points are really good. So, you know, try to find events that are noteworthy rather than asking, you know, what did you do 2 weeks ago? So, you know, rather ask, for example, what did you do before you fell ill or before you visited the doctor, the physician, to get your test. Or in our case, we asked, what did you do before the lockdowns were enacted for the first time? And yeah, that's essentially it. I'm looking forward to your questions.
Thank you so much. And thanks so much for being willing to spend the time with us and join in, as I said, late in the night for coming in from Europe. This is just some really fascinating work, and I'm very keen to dive into it. I guess to get started here, and I should remind everyone, sorry, I should remind you that if you're watching live, please do share your questions via the chat box here in Zoom or on the YouTube live stream, and we can pull them into the conversation. I think my plan here, though, is to start with a couple of sort of small clarification questions, and then to go into some bigger issues around these different kinds of social desirability biases that you brought up, and the question of objective reality and those sorts of things. So to start with a couple of just small questions, I'm really interested in this phenomenon you articulated where on aggregate, there tends to be good consistency, but for individual cases, the consistency is poor. Are we just lucky that that's the result, or do you have any sense of why it is that this measure works on aggregate when it perhaps is not working so well as a reliable measure at the individual level?
So this of our findings is pretty consistent with what other research have found, and probably the most intuitive way to understand why this is on the aggregate level, if you think back to the coefficient for our multinomial regressions. So those whose situation hadn't changed were pretty good in giving consistent answers. Those whose situation deteriorated gave more negative answers, and those whose situation improved gave more positive answers. And this means on the aggregate level, the more negatives and the more positive weigh each other out. And this is probably a way to make sense of this otherwise, hard to grasp phenomena.
Interesting. Yeah. So if those populations are indeed balanced, you're likely to end up with the aggregate coming out of the wash. Yeah. There's an interesting question to this end in the chat from Giovanna, wondering about whether there's been any work or whether you have any sense here about disentangling recall biases in terms of those who have had COVID or at high risk of COVID. Did anything in terms of risk profiles or personal experience seem to affect this, or do we know anything about that from other research?
So maybe this is going back to this very same issue. So, if something traumatic or even not so traumatic has happened, I adapt my assessment of the past. If you think about risk aversion, or how often did you wash your hands, or whatever. So there is this adaptation, and so I think this is something that you need to take into account. So maybe, Ivana, if you have a more a more concise question that you would ask, maybe it's easier to think in which direction biases may go.
Yeah, I don't want to put you on the spot there, Giovanna, but if you do want to share more details, feel free to add those in. I think it's interesting to see whether that could be parsed out, though I will admit that even in some of our data sources, it's a little challenging because even early in the pandemic, we just did not have that many COVID positive respondents, for example, to be able to parse that out statistically. And thank you to everyone sharing questions. We'll pull these into the conversation as we go. But I'm curious here to think, so you had mentioned here in your recommendations towards the end, you suggested that it's important to focus on objective questions rather than asking folks to make subjective assessments. And I'm wondering if you could elaborate a little bit on what you mean by that piece of advice.
So The 5 questions that we examined, and we can probably discuss about how we classify these questions. So 2 were about when and how often did you work at night or at evening. So, and you had 5 answer categories. So, and you can count how often, you know, if you think back to the last week. So how often did you do that? And this, in our opinion, was more objective than how often did you feel strained, depressed, and, you know, I can't remember the third item now, in the pre-pandemic time, or even for now. This is, of course, much more subjective. So how do I feel today? How happy am I with my life? So these are subjective assessments, which we as survey researchers care a lot about, but they are harder to answer, and you have a lot of more noise in these measures than if you ask about, I don't know, level of education anyways. So, you know, even if you ask these questions for the present, they are more difficult for survey researchers, but they're even more difficult if they have to be answered by respondents for the past, I guess.
Mm-hmm. Yeah, that makes good sense. I mean, in some ways comes down to the operationalization of different measures too. Some of these are very straightforward as things, were you working or were you not? And other ones of these, like how good was your mental health, become very complicated operationalizations for someone to think through. To that end, did you notice anything or learn anything about the sort of pre-post lockdown in terms of that term lockdown itself? So, I mean, maybe this is a question about the happenings in Germany to a degree, but for instance, here in Canada, we've been in a phase of sort of tapering into and out of second lockdowns, and that has become a very wishy-washy and nebulous kind of term. Whereas in March, there was a much more clear-cut anchor moment. Did you have a similarly clean-cut anchor in Germany, or was the lockdown something that varied and became a challenge in the question?
So I was only talking about the first lockdown in Germany, and, you know, we finished our data collection in August, and only now in November we're in the second lockdown light, and this resembles, I think, you know, what we experience or what we are going through in Germany at the moment is more your wishy-washy lockdown start in Canada too. So I think for the, you know, when we asked the retrospective questions during the first lockdown, everyone knew, you know, it was March 23rd, and, you know, this is when things have changed. This is when school have closed and public life was essentially shut down. But I would not recommend, you know, asking this question. So how, you know, was your pre-pandemic situation? How was your situation before the second lockdown? This doesn't give a good answer to people, because the experience is very different. So where do you locate it? So it isn't as clear anymore. So I think if you do research and want to ask retrospective questions in the situation as we experience it in Germany at the moment, you really have to think hard to find some better anchor, I guess. I hope this answers your question.
No, absolutely. I think about it just because we've been struggling a bit with this in our surveys right now, is that it used to be that there was a very clean cut before versus after. Mm-hmm. And this question of, for instance, having people compare something to normal is now a much more difficult question, because normal can be defined in a wide variety of ways. Mm-hmm. Okay, so I want to move now to sort of a couple of broader questions about this whole idea of retrospective bias and some of the bigger picture challenges here. So one of them is that I was struck as you were talking about the 2 different stories that you could tell here, right? So one story is that retrospective errors like this are just that, they're errors. They're places where people's memories are degrading, places where people are forgetting about how things were and are backfilling that, places where people are becoming less accurate in their responses. But a second story is that this is actually a real phenomenon in play, right? That the question of how you situate yourself today versus yesterday is a sort of real perception that does change and does modify and tells us something about how you see yourself today. Mm-hmm. And so in the first story, this is sort of a source of error for us as survey researchers. In the second story, this might be something that we want to take advantage of and perhaps track over time how someone's comparison of where they are now to what the past was like, how that changes, and deal with that as a sort of real and interesting psychological element of our research. So I'm curious to get your reaction to that, and to get a sense of whether you think there are substantive things we can learn from the way people's memories change and adapt, or whether we really just need to see this as a source of error to be minimized. Does that make sense?
Yeah, yes, it does. And so I'm probably not the only one in this round who has an opinion on that. So if you think about it from the perspective of a public policy maker, for example, if you want to assess, whether social distancing has helped to keep infection rates down, for example, you are really interested in objectively how many people your population has met on average, and how this has changed over time, to understand how social distancing might have influenced infection rates. And there are other things too. I don't know, we are doing a lot of work on work-family issues, so how people divide up paid and unpaid work, for example. So personally, I'm more interested in, how they objectively do it than making sense of it. If we believe the finding that we had and that other research also had, that we retrospectively adapt our perception of what had happened, both subjective information and objective information. So from that point of view, I would say no, I'm interested in how things were and not how people made sense of at a later point. However, I think, from a more social psychological perspective, it is interesting to see how and under what conditions do people adapt their perception of the past to the present. And of course, I can only, examine this question if I also know how the past was. So if you take the example of how do people divide paid and unpaid work, for example. So if I have the measure of how, couples do that at time 0 and then at time 1 and then 2, and then I ask him at time 2, so how did you do it at time 0? And they say something different. I think it's interesting to see what the correlates of explaining this change are. So is it, because, the relationship got sour, or, there was an additional child, or, I don't know, there was a cleaning help hired or something. So I think this would also be of great interest for me as a social scientist, but and there's certainly other areas or other questions that you could use that for, but in most instances, probably I would be more interested in how respondents answered the questions in the past than how they answered it for the past, I guess.
Yeah, really interesting stuff. And for us as researchers, it really just multiplies into lots of interesting questions to evaluate. I am curious to come to this idea of the actual measure and the real value here. Because this is something that came up a few weeks ago in our discussion, the challenge of getting a good objective measure against which to compare these things. So I'm curious, sort of what you've personally thought and what your team members have thought, if they want to chime in as well. What you have thought in terms of what the gold standard and what the best realistic comparisons would be here. What data do you wish you could run this against? But also, how do we sort of realistically make sure that we've got that comparator there, something that we can trust is that actual or objective initial level?
Mm-hmm. So, I mean, of course, you always want high quality longitudinal data, you know, and most survey researchers today would still say face-to-face interviews generate on most items the least measurement error. So this is where you would wanna be if you could decide, right? But now face-to-face interviews are difficult. In our case, for example, we did not collect data at the time before the lockdowns because we didn't see the lockdowns come, and you know, most people, you know, in many surveys probably people are not immediately interviewed before they were diagnosed COVID-19 infection. So I think, you know, what I've learned, or what my personal conclusion based on this little research piece was, that if you use retrospective questions, think carefully about the bias that you have. So in which direction may they influence your estimates? So for our study, our conclusion was that's probably, you know, they are more conservative than you know, than what might be actually the case. But I think really trying to think about it, and also, you know, think about the validity for each single item that you have assessed retrospectively might be good. So was the question, you know, overly complex, which always leads to measurement error. Complex questions are always difficult for people to answer. So I would just, and I think this would be my recommendation, just to be really careful in the interpretation. Yeah.
Yeah, thank you. And unfortunately, we're starting to come towards the end of our time. So if you do have any last questions to get in, please do share those in the chat, either here or on YouTube. Speaking of the chat, I want to link what you just said to a question from Daniela regarding sort of other potential data sources for comparison here. And her question is about whether the use of say, diary studies would be able to provide some interesting points of comparison here, and options for comparing the perception against the actual behavior. So doing micro surveys of once every day or once every week, those kinds of data sources. Have you used those at all? Have you looked into them? What could they offer here?
Mm-hmm. So I think diary data would be just perfect. I mean, they are probably the most detailed information that you can get. So I'm mostly doing quantitative research, but you know, one thing that we try to do is also we use survey questions from existing longitudinal studies in Germany. So we have a baseline for the general population that we can compare our weighted T-1 assessments to. So if we see that, you know, with our data, you know, the retrospective information matches those that was found for similar items in other survey. This gives you a good hint that, you know, you might not be totally off. But of course, the problem is, you know, if we ask respondents about the pre-pandemic situation, you know, it's not, you know, April 2019 that we should really compare it for. A lot of things could have happened, in the 10 or 11 months between March 2020 to, for example, April 2019, when, for some of the measures, the last time they were collected in a representative longitudinal survey. So, but comparing your data on retrospective questions to other longitudinal data and diary data are, so time use surveys, for example, they are almost like diaries, right? People have to write down, what did I do from 7 a.m. to 8:30, and write it down by the minute. This is really, really good, and you have high quality data to compare it to. That's great.
And I will use this as an excuse to tease our next presentation 1 week from now. We're going to have the Pandemic Journaling Project in for the session. And they're doing a very large-scale, long-term diary and journal-based study of getting people to basically write diary entries and journaling entries about their experiences in COVID. And so I think that will be a great continuation of this conversation next week.
And great transition.
Yes, absolutely. Okay, we have time for just maybe 2 more questions here. So I'm curious to ask one that that links up your presentation with a discussion we had with Jean-Francois a few weeks back, looking at social desirability bias. And you hinted at the way that social norms can change over time. And that seems particularly relevant and particularly salient in this case where, I think about masking in the Canadian context, and we went from public messaging explicitly against masks, right? Need to preserve the supply chain, make sure that doctors have them, don't need to wear masks, to very pro-mask messaging, to now a sort of resurgence of anti-mask sentiment among conspiratorial groups. And so I'm curious to what degree it's possible to isolate these failures of memory and failures of recall versus perhaps changing social norms, changing political messaging, and even the potential for researcher demand bias. So sort of changing perceptions of what we want to hear from them. How do you begin to tease those apart in these studies?
I think there's not really a way that you can tease them out. And, in particular, the shift in norms, and I like your mask example, is one that can even make retrospective questions on the aggregate problematic, right? So not if only but the entire population adopts their attitude towards masks, because now everyone should wear them and everywhere. So I might also very likely say that even before I was in favor of masks, and because this was a shift on the societal level, this might even mess up the accuracy of your retrospective measure on the aggregate level. So I think this is a really good example for the point that I wanted to make before, that you have to be careful if something such fundamentally occurs, then retrospective measures might not even work on the aggregate level anymore.
Yeah, tricky stuff. And JF, I'll leave you to collaborate with new connections here to try to figure out how we can suss that out. He's got an interesting suggestion he just threw into the chat, harkening back to his presentation around face-saving strategies and encouraging people to reply in earnest ways there. Okay, so one of the things that you hinted at a few minutes ago was the challenges we face in not having baseline data, right? That many of these research projects get launched when the crisis hits. And this is something that is a big problem for me in disaster research, right? All of us in the field face the challenge that all too often we can only start collecting data after the disaster has occurred and people are now willing to spend money on that research or the like. Whereas in an ideal world, we would want to have good longitudinal pre-event data at a granular level and with large sample sizes to allow these comparisons. I'm wondering if do you have any lessons learned or any recommendations, any things we should keep in mind when we're thinking about what kind of longitudinal data we should be prioritizing, what kind of baseline information or measures we should collect? How has your work on these retrospective biases changed your wish list for what you perhaps wish that we could collect more regularly as a preparedness step here?
Yeah, I mean, the thing is, with disasters, so often you don't see them coming. So if there are, of course, also disasters that we see that we see coming, or they have a high likelihood to occur. So of course you need to be prepared. So with COVID-19, probably, I mean, of course, there were epidemiologists and also, national security who said, there might be worldwide epidemics, and we have to be prepared. So I think the most important point is that we have longitudinal data and that they are well funded and regularly collected, and that you spend a lot of money in having good data. So if you look at survey response rates, so we have a big problem there. So people are less willing to participate in surveys. So attrition in panels is usually lower than people's willingness to participate in any random survey. But thinking about the respondents and how we can keep them, and how we can have high quality samples, this is probably the most important thing when you don't know what is going to come. And maybe one remark on Jean-François' comment. I think, this entangling recall bias from social desirability bias is potentially possible in survey experiment, and it's a really good idea. Maybe we can talk about this. I just saw it in the chat. Sorry for this deviating.
Not at all. Part of what we're looking to do with this group is to make those kinds of connections and spur on conversation about how these different challenges interact. Okay, so one last question and then we'll wrap this up. I'm curious what's next for you. Are there any plans to run this measure again and look at how things change looking a year back, for instance, or how things change over a longer term? What is coming next in this research project and your COVID research in general?
So for our survey, it was mostly substantial interest that we had in how people's daily lives have changed. And we are planning to run a fourth wave of data, interview our respondents again 1 year after the outbreak of the pandemic. But this is mostly driven by substantial interest, which might also be of interest here in this group. But the methodological paper was really, if we are honest, was a byproduct of an nice nice thing that happened that we hadn't planned for, with this really turbulent data process collection. So yeah, so I think the things that are going to come will, for our COVID research, will be mostly related to substantive questions.
Well, we can't wait to hear those results and to learn more about that ongoing work. Thank you so much for being willing to share with us today. And we hope that you'll share these updates as they come out, and we'll be glad to circulate them with the group. For everyone joining these sessions, just a reminder that we've got some great sessions coming up in the next couple of weeks. So I'm really excited for that pandemic journaling project session that we'll have on December 2nd. And then on December 9th, we'll be joined by the Angus Reid Forum. They are going to present both some of their web-based survey research on COVID-19, but also talk about the way that COVID antibody surveying has been integrated into their more traditional web survey designs. And so I think that will be a really interesting conversation about public opinion research and its connections to public health. So I hope you'll join us in these coming weeks. And with that, thank you so much for being here. Thank you, Dr. Hip, for all of your insights and your very practical tips. And to everyone, stay safe, have a great week, and we'll see you next time.